Hello, everyone. I'm Marissa. I'm the patient care coordinator at Panacea. Today we are doing things kind of virtually because of everything. So right now we have one of our with us, Mr. He's gonna talk to us about his journey that he's been through here with us at Panacea. So go ahead and introduce yourself.
Hey everybody, my name is Jesse Sutton and I'm an Atlanta native, been around Atlanta for quite some time, and I work in online training development, and so I got my surgery with Panacea probably just a few months ago, so pretty recent, so hopefully I have some things that I can share that are beneficial for you all.
And if you could share with us what procedure you had coming into Panacea.
Okay, so I had bilateral mastectomy, but it's known as top surgery for other people who are of the trans community.
So what was your journey like coming into Panacea? Like, how did the doctors make you feel? How did the staff make you feel?
Right. So it was really quite a great experience. I was a little bit nervous. I'm not someone who typically goes to doctors for many reasons, but I was a little nervous to go there, and everybody was really nice and welcoming to me. As a person who is a part of the trans community, when you go to doctors, sometimes that experience can be a little bit uncomfortable, the questions that they ask or the responses, and it wasn't that way at all. Everyone at Panacea seemed really kind and were very excited for me. And so and on my team going through it was really beneficial. So it was a great experience.
Did you have any concerns going into your consultation in the beginning? I know
Yeah.
a little bit on it, but
Yeah. So just like everything else on the internet, there's a lot of resources. There's a lot of things that people will say that aren't completely accurate. So I had a whole lot of questions and I didn't really know what the answer was going to be. And sometimes they'll say that you qualify for this surgery or this surgery, but it depends on all these different things. So I walked in not knowing what I was going to qualify for, what the doctor was going to be able to do, really how long the recovery time was going to be. And so I had Dr. Ibushi, he's who I worked with, and he was really awesome. And I had all these questions, and he was really patient as I asked all these questions. And it was really informative and straightforward with me. Like he said, initially I wanted to go for the keyhole surgery, and he said that very few patients qualified for that surgery. And then after looking at everything that was going on, he said I could have qualified, but it would have been better to do the bilateral. And he explained why, and he gave all the reasons why. And so honestly, he was very informative. So all the questions that I had, he was able to give me great answers for. And I know that a common question for a lot of trans guys is the dog ears question. That's one of the main things people look for or look at in pictures and such. And so I brought that up, and he very calmly explained that that may or may not happen. It just depends on how recovery goes. It's not something that you can predict, but it's something they can fix on the back end if necessary. And so even right now, as I'm going through the post-op procedures, I'm putting on different creams and stuff like that he's recommended and going through what he said. And I may or may not have to have one side fixed, but he's not concerned. And so I'm not concerned because he's not concerned. So overall, that was really my experience in that way in terms of the initial questions that I had. And then, of course, as I had questions along the process, they answered them. But I mean, that initial one, I probably had 10 questions on a note that I just read off, and he just answered everyone as I asked. So it was great.
good. So do you have any like recommendations for other patients coming in or anything like that?
Yeah, sure. So first off would be do check with your insurance and see if it's something that they cover. I was like so sure that my insurance wasn't going to cover it. And so I didn't honestly take a really hard look at it. And I have United Healthcare. And so I went in and I reviewed it, and it turned out that they did cover it. And I put in my claim, and they initially denied it, and then I rebutted it, and they eventually approved it. So just look at your health insurance, and it may be covered even though you may not think it might be. And it may be that you have to do a little bit of tweaking or pushing back, but sometimes it's just getting a doctor's note or a therapist's note from a sex therapist or something or a sex change therapist or something like that can help you out with that. Another thing I would recommend is that you'll need more help than you think you will. I don't have like a significant other at the time, and so I was like, oh, I'll be fine. I'll just move straight through it. And I had friends that were medical professionals and told me no. And it's a good thing that I listened, because I needed a lot more help the first few days than I thought that I would, whether that be just being able to like get up and off the bed, or having someone remind me to take my medications, because you're on some pretty intense medications for the first few days. And so everything's a little cloudy. So that's another thing that I would say. But one thing that surprised me was that I really wasn't in as much pain as I thought I would be. And maybe that's just the meds, but it really wasn't that painful of a process on the back end. I mean, of course, there was some pain, but as long as you follow the orders and do everything that you're supposed to, it really isn't that painful. So just making sure that you're laying low and being calm and letting people help you should be a big way to reduce the pain on the back end.
Right. So you would say that your recovery process wasn't too bad?
No, not at all. I was getting pretty antsy. I'd go to the gym pretty often, and so by about week 4, I was like really like, oh, I missed the gym. And so it's just like making sure that you're staying on that. Do not go to the gym. Don't work out. And one thing that Dr. Bushi told me was like, yeah, go out and walk, do those things. So I'll go out and go on an hour walk or an hour and a half walk a couple times a week, just because that was something. And so you can ask him based on whatever procedure that you have, whether like what kind of workouts he'll recommend that you do. And it may just be walking. And so that's what I did. I just walked around the neighborhood a lot, or tried to do things that didn't cause too much movement across my chest. And so that helped with my mental state to feel like I was still working out. And he also was able to adapt to me a little bit. So like after my 6 weeks are up, he was like, you're free to go back to the gym, which I was surprised, because most of the time they tell you that you can't, but I had healed well enough and followed instructions. And that's not with everybody. Like it just really depends on your genes, he said. But for me, it worked out well. So I was able to go back to the gym after that 6-week process. So again, just like following the instructions, because I got like all these packets and I read through them ahead of time to make sure I was aware of everything and what I couldn't do, and making sure that you do your drains. The drains are annoying. They didn't hurt, but they are annoying. So just know that like when you're trying to go to sleep and stuff like that, just like pin them to just things like that. But other than that, the recovery wasn't too bad. It was more of just making sure that I was doing what I was supposed to be doing. So.
Good. Good. And I know you kind of touched a little bit on it before, but for other patients going in any surgery they're doing, any procedure, it can be very nerve-wracking.
Yeah.
How important is it to you to feel comfortable when you walk through the doors? And how did it make you feel when you walked through the doors of Panacea, from when someone gave you a phone call,
right,
all the way up until your last post-op with us?
Right. So it was really nice. Everyone is super happy and excited. It seems like everyone enjoys what they're doing at their job. And so we walk in and everyone's really excited, and then you sign in, you get met with a smile, that type of thing. And even when I went into the hospital, because we was at Duluth Medical Center, Gwinnett Medical Center in Duluth, and I walked in and engaged with the staff there, and they were all really just super kind and nice. And then Dr. Bushi came in right before the surgery and talked me through everything and told me what to expect, and that he was going to be updating the people that were there supporting me throughout the process. And then I met with the nurses after the fact. And so I do think that having a positive mindset throughout the entire process is really, really important. And so like going into the surgery day, I was actually really calm. And I'm sure a lot of that was because of the amount of information I was provided ahead of time. I'm a person who enjoys having a lot of information and prep. So being able to know like what to expect from the people in the office, to also the calls I got from the hospital itself, all of those things helped me feel really calm. And so the day of, there was really no unexpected moments or things I wasn't ready for that made me feel really uncomfortable. And then I've been having even afterwards, and I went, I think it was every 2 weeks or 3 weeks, I went for post-op appointments, and I met with Dr. Bushi as well as Amber, and Amber was really awesome in helping me and walking me through my drains and everything. And I had to have my drains in longer than other people. I'm not sure why, but I did. And so they were all real sympathetic to me for having to have those in a little longer than usual. So yeah, I mean, it was great being able to have someone on the side to be able to support you and be excited for you that the process was moving along well, because as you know, top surgery is something that it can really help in with just the day-to-day, from being able to breathe normally to being able to go to the gym and feel more comfortable, all those types of things. And so to be able to have staff that can understand why that's so important and to be excited for you was a huge win.
Good. Well, I am glad that we were able to make you happy, Jesse. I don't really have any other questions for you today. I really do appreciate you sitting here and talking with us. Do you have anything else you would like to say to future patients that come into Panacea?
Sure. I mean, just follow your directions and be as patient as possible, and know that the results are going to be great. I have been really pleased so far, with really blown away. And Dr. Bushi was made sure he took the scars alongside my muscle, which was really cool. So as I continue to work out, it should be able to hide those muscles. The muscles will hide the scars, I mean. So just like the fact that he was really tailored into my experience made it feel like I was really going to have a great result. And so far I've had great results, and I'm excited to see what happens in the future. So I'm only just a few months out from surgery, but I can tell you that I have no regrets at this point. So.
All right. Well, I just want to thank you, Jesse, for taking the time to speak with us today and let other patients know about your personal journey, as well as let everyone else know if they have any questions or want to schedule a consultation to give us a call, 770-929-0634. Thank you.